time, and that can be really challenging even when conditions are favourable. As we know, conditions are far from favourable as people are trying to recover and transform services. At the moment, they're simultaneously having to navigate organisational reform, workforce challenges, budgetary constraints, and continual operational pressure. In that context, recovery programmes can often be characterised by volatility, uncertainty, certainly complexity and ambiguity. And VUCA has become something of a motto in the national COVID-19 vaccination deployment programme, where the delivery of seemingly impossible objectives in impossible timescales has become the norm. The pace is unrelenting, and the complexity comes often simultaneously from the emergence of new vaccines, new variants, new priority cohorts, changes in policy, and new guidance from the JCVI. So what is often true in the morning on the programme is often different by the end of the day. And a day can feel like a week in normal programme terms. And nothing stays the same for very long. There are about 500 people in the national programme team, with partners from health and care, government, the military and commercial organisations coming together and harnessing their combined capabilities to achieve a shared purpose. And the mission, as you see on screen, is really clear and everybody's bought in. It's just really hard to execute and deliver. And yet it's been one of the most successful programmes in our history. Among other strands of support we're providing, SCW runs the Central PMO, a team of up to 44 people at peak, who deliver so much more than reporting and assurance, because that's how a PMO can be perceived, right? Reporting and assurance. But the Central PMO has been the heartbeat of this programme. They've been cultural leaders in the programme, and they've been absolutely fundamental to driving collaborative delivery at pace throughout. So I'm delighted to be joined today by Mark Angus, who's the PMO Director on the National Programme. And Mark's going to share some thoughts on our experience and the value that can be achieved by investing in the right skills and experience at the core of the most complex programmes. So over to you, Mark.
Yeah, thank you very much, Ben, and thank you, all of you, for taking some time to listen to what we have to say. And really what I want to try and do is just give you a better flavour of the journey we've been on and the lessons that we've learned and how we've had to adapt and evolve in terms of our PMO offer. So I'm the PMO Director. I've been on the programme for about 15 months. Initially I was the Deputy Director and moved into the Director role in November. And the first task that we had was back in April. We had to manage an operational transition from a consultancy delivered PMO to a more sustainable model. The consultancy that had established the PMO had really built the PMO and established it. It was a bit like building a plane whilst in flight. I know that's kind of an overused phrase, but it very much was that. Our job was to take over controls of that plane whilst learning to fly the plane, whilst the environment was quite turbulent, back to the VUCA environment that Ben referenced. How do we do that? Well, the first thing was we worked really closely with the organisation that had been providing the PMO, did some really detailed planning to understand what the needs of the programme were, what the roles and skills requirements were, and then carefully, in a considered way, managed that transition with inducting people into those roles. We transitioned 27 people into the programme over a period of 6 to 8 weeks in a very carefully considered, managed way. Of course, there were teething problems. That just goes without saying. But I think our aim was to do that without anyone on the programme really noticing. All that changed was the names and faces in the room or in Microsoft Teams. And I think largely we were very successful in achieving that. Once we'd made that transition, it was then to get on with the task in hand. And the first thing we really wanted to do was to further embed the PMO function within the programme, and to demonstrate the value and impact that the PMO could offer to the programme, with a focus on enabling that delivery of that mission that Ben covered earlier. So how did we do that? Well, the first thing is the role of the COVID PMO is really to be the critical interface between national strategy, direction and decision making, and turning that into and translating that into operational delivery to get that impact and value, and to do that really, really quickly. We were having to pivot and change continually to meet the needs of the programme at relentless pace. The first thing was to make sure we got the fundamentals right. So all those kind of fundamental things that you look to a PMO to do, so the governance, risk management, your templates, your systems, your processes, all those things you either love or hate, but actually protect the programme, keep the programme on track, and as a safety, and keeps the SRO for the programme safe. And that was particularly important in this programme, given that there's a public inquiry and we have to provide a lot of information into that process. So it has to be robust. But our approach was to be more than just that type of PMO. We wanted to be, and somebody called Laura Barnard, who's the number one influencer internationally around PMOs, talks about PMOs being a high impact engine, enabling collaboration, solving problems. That's how you create the value of a PMO, is helping an organisation or a programme identify the problems and then helping to fix and solve them. I think a few kind of key ingredients. I think the first thing, which is a bit of a reflection, is my role as the PMO director is valued. I sit at the top table. I'm part of the senior leadership team. That means that as policy and strategy is being formed, I can bring the knowledge that the PMO has into that thinking, but also as that decisions are being made, we can rapidly support them being delivered. I think the second thing is we actually facilitate all of the senior leadership touch points. The national team with the regional leaders, every session we facilitate that and create the right environment to have the right discussions and ensure the agendas are focused on the right things, that the flow of information is there to help inform rapid identification of issues and solutions. The second thing is our model itself, over half of our team members are based in the work streams. So they work on a day-to-day basis within the programme work streams. They build those trusted relationships. They understand the business of the enabling work streams and the delivery work streams. They're there to fix and solve problems. Yes, they're there to do all the governance stuff and the RAID logs and the decision registers, but they're active in working with those teams. The real benefit of that model is that then at a central PMO level, we've got go-to people to get a flow of information that we can knit together, integrate and play back to the senior leadership team and the wider programme, that information sharing piece. I think the other key ingredient is being agile and responsive to the programme needs. So we've got quite an agile approach to resourcing. We've gone, when we first started, we had 27 people. We then, as the needs of the programme became more complex, there were more demands on the programme, we scaled up to 44 people with a range of skills and capabilities, and now in the process of scaling back down to a more sustainable approach as we think we're going to move towards a more business as usual approach, but every day something new hits us that we have to respond to. So what does make a PMO successful? I've kind of touched on this, and it is that impact and value thing. And how do you make an impact and value? I think if you look at the evidence that's out there, it's really difficult to make a case for investment in PMOs. How do you get a quantifiable return on investment? How do you measure the impact? I think my reflection is, and I've had PMOs work to me in previous lives, I've been a chief operating officer, I've done system transformation, I've commissioned PMOs, is that relentless focus on problem solving. That's how you generate value. That's how you're perceived as making a difference. If we go on to the next slide, I think one of the key components, and Ben mentioned this, is about that cultural leadership piece. So being that facilitator of the senior leadership team, being that corporate knowledge bank, that repository, that corporate memory, we're in a unique position to really establish the tone of the program and the pace of the program. And there's a relentless focus on that mission, so that we make sure that everything we do is focused on delivering that mission, and that we're not going off piece and starting to get into some things that are not going to impact on that mission, which is jabs in arms as quickly and safely as possible, tackling inequalities, and saving lives and protecting lives. That's what it's about. If we're not talking about the things that will make that happen, then we're not in the right place. And the PMO has a role of keeping people focused on that. And whilst the COVID-19 program is quite unique in that I think that mission applies to everybody, personally and professionally. So it's a bit more straightforward to get people to buy into that, I think, right? And people put differences aside, they put styles to one side because they can see that's everybody's got skin in the game. So I think it is important in different contexts to work on that mission and really get that buy-in, because it is so powerful, and to keep coming back to it. I think the next area is around the battle rhythm and that cultural leadership piece within the battle rhythm. The pace of delivery is relentless within the program, and we've had to shift gear on numerous occasions. And more recently, the Omicron emergency response just before Christmas, where for 3 weeks we needed to extend the offer of a vaccination to all adults, bringing delivery forward by a month, working 7 days a week over the Christmas New Year period. We had to adapt and respond to that. One of the big themes of this conference is about collaboration, and I've talked about that unique place that the PMO within this program sits. It's that interface between internal and external stakeholders, and how we as a PMO behave really does influence the culture in the program. Because if we were one of those directive PMOs that are holding people to account and measuring everything and calling everything out, then it's not going to engender and embed that culture of transparency, so we really get to what the issue is. We need people to feel that they can talk openly, call out if they think something's not working to deliver that mission, and we play a role in ensuring that that's the case. We use a balance of soft and hard tools to enable that, with that relentless focus on the vision and the objective, and promoting the program values, building trust, credibility, and maintaining the strong reputation of the program. By doing that, people feel more incentivized and inclined to support the program, rather than feeling defensive or wanting to point the finger. They're all in with you. And we have something called #OneTeam, which the SRO who set the program up has really instilled within the program. I think consistency is really important. So it's quite a dynamic program. We have the program itself, up to 500 people. There are people constantly rolling in and rolling off the program. And within the PMO team itself, we're managing that transition. And I think we work very hard to make that as seamless as possible. But because we hold that corporate memory, because we've got the understanding and we've got the systems and processes placed at that central level of the program, we're able to support people coming into the program so they feel they're coming into a supportive environment. They know where to go to get information that will help them. And we very much play that sort of strong and consistent role. I think an example of the way in which we help solve problems and use learning is how we use the skills that we have within the PMO team to collect information, data and qualitative information from horizontally and vertically, and then synthesize it and play it back to the program, and ensuring that we're using every touch point that we have as an opportunity to learn. I think one example of where we did that was we identified an issue, and the issue was low uptake in inner city urban settings. each region, each system that had that cohort or had concentrations and big urban environments were all trying to tackle the problem individually. So what we did was bring those systems with large urban environments where that was an issue together, so that they could share what the issues were, what their innovative, creative solutions were, so that we shared that learning across the whole country. We played a part in pulling together the data insights, going out and getting the qualitative information, synthesizing it, playing it back, and there was real value seen in that. And on the back of that, a network was established to continue the learning and information sharing. We have a sort of 3-tier approach to learning within the program. At a program level, we have led and embedded a after-action review process. So every time we have implemented and rolled out the program to a new cohort, we formally facilitate an after-action review, we capture the learning, and then we make sure that that learning is played into our future planning. So we're continually learning. Every time we do something, we learn, and we play the role of making sure that we harness that and improve what we do. One of the things we've done with that as well is that we have developed, at the early days, it was kind of making it up as you go along. How do you actually roll out the offer to a new cohort? We've now developed a standard tool that we iterate and improve every time, which is an off-the-shelf, this is what you do, and these are the checklists, this is what you do to roll out a new deployment. As a PMO team, we have regular touch points, we're always sharing successes, we're learning from each other, we're going out and getting the best practice evidence and thinking about, we've seen this new tool, this new approach, would that work within our offer to the program? And then obviously it's really important at an individual level that we're, particularly in this sort of environment, we pay a lot of attention to health and well-being. We make sure people feel supported. We say no one should ever struggle. We have an open approach to people saying, look, I'm getting overwhelmed, and we work quickly to address that. We share learning as a PMO team, and we celebrate successes. We have a Top Banana Award every week that's awarded, and I think it just creates that right sort of culture. I don't know if you've had PMOs, some of you will have done. I think you've probably, like me, had mixed experiences of whether they've added value, made an impact, but do not underestimate their ability on that learning piece. I think they are, if they're set up right, can really help take learning to create value and make a difference. So I think the 3 reflections from us, I think I've mentioned the first one already. There are lots of standard tools, there's lots of books, there's lots of things on the web, there's lots of people that tell you this is what you do as a PMO, these are the tools that you should use. I've never run a PMO before. I don't know if that's a good thing or a bad thing. I think it's a good thing because I didn't come along and say, this is how I run my PMO, this is what you're going to do, this is what tools we're going to use. It was actually, what does this program need? What do we actually need to fix? What are the things that are going to create that value and impact? And then done a pick and mix of what we need to use, what tools to use to fix those problems. Very much a can-do attitude. So every day somebody says, we've got this problem, can you come and fix it? Right? We need help. We need more resource to do this. We need somebody to do that. We never say no. What we say is, we'll see what we can do. Let's see if we've got the right skills to fix that problem. And then we will adjust our resource model where we can. And I can't think of a time where we've actually said, sorry, we can't do it. We've always somehow found a way to respond in a very rapid way. We've taken responsibility for, so I think that built bespoke tools and products is something I've referred to. Rapidly adapting skills and capability. I think in the outset when we set up the program, we just thought, although we'd worked with the consultancy, it was, we need a lot of project managers and program managers. And I think a lot of people do that. We need a PMO. Let's get a bunch of project managers and program managers. We'll put them in an office and they'll just keep score for us. And they just tell us if we're hitting this milestone, not hitting that milestone. We didn't make that mistake completely, but I think we over-egged it. And what we learnt and understood in the end was we needed some more specialist skills, and we needed some facilitation skills, and we needed some specialist planning and risk skills. So we quickly adapted, and in hindsight, we probably should have spent more time talking to the stakeholders, the end users, about what their problems were. And I think the final bit was, in our eagerness to help, I think there were points where so much was happening and we were leaping in to solve so many problems that we started to weaken the fundamentals. And I think it's really important that the fundamentals are robust and resilient, and that you don't lose focus on those, because that's what our SRO will be defending if it gets called in front of the public inquiry, is about that governance. So that's just one of the reflections. You've just got to maintain that focus on the core. So I think this is the last slide I'm going to talk to, and I really want to highlight, it's great to see Sue Blackman here, because Sue is fundamental to this. She's no longer with the programme, which we're really sad about, but she's doing fantastic things in primary care. But this is a really good example of a problem the programme had. So back in July last year, the programme had opened the offer to the elderly and vulnerable cohorts. We were moving down and getting to the younger and younger people. And when we got to July, we was offering it to over 18-year-olds. And as we got into August, it was 16-year-olds. And we found that younger people wanted to access the offer in a different way. You know, the more elderly are so used to accessing services through their local GP practice, getting a flu jab. They interact with their GP practice more frequently than younger cohorts. Some of the younger people may have never been to a GP or interacted with NHS services at all. So they really wanted convenience. They wanted the ability just to walk in and get a jab when it was convenient to them. We also had a lot of hard to serve communities, ethnic communities, who really valued local convenience, and they didn't really want to have a booked appointment, they just wanted to walk in. And also people at work who couldn't afford to take time off for work to get a vaccination. Now, we had a walk-in service. Up and down the length of the breadth of the country, people could walk in and get a jab. The problem we had is we didn't have visibility of it. We had a national booking service that you could go to and book an appointment to get a vaccination, but you couldn't find out where your local walk-in centre was, how many hours it was open for, etc. So the concept was born of grab a jab. And the idea was, we're going to have a website where all this information is, and it's going to be updated on a live basis, so people can be signposted to it, so they can find out where they could walk in and get a vaccination. So, who was going to solve the problem? PMO, could you help? Up steps Sue. We reallocate, reprioritise. For 7 days, non-stop, we worked to gather all the information across all systems, all sites, all regions, hundreds and hundreds of bits of data and information, validated it, checked it, put a system in place to continually update it, design, develop the website, and go live. And from concept to go live, it took 8 days. So, that's quite phenomenal, I think, by any standards. I'm not just saying it because I was leading the team. Sue is instrumental. But that just shows the power if you've got a PMO that is set up in that way to be responsive. It's not just a nuts and bolts, bolt-on thing that just keeps you safe and fills in templates, etc. It enables you to deliver what you need to deliver. I think the final reflections from me are, if you come back to the theory, there's directive PMOs, supportive PMOs, hybrid PMOs, enterprise PMOs, agile PMOs. There are all sorts of descriptions about what a PMO should be. The latest is value-driven PMOs. Certainly in business, they talk about value-driven PMOs. What's the bottom line? What's the return on investment? I was at a conference last week. A chap called Americo Pinto, who heads up the PMO Global Alliance, has been doing some extensive research on what makes a successful PMO. It's not published yet, it's due to come out in September, but he was able to share with us some of the findings. And one of the key things was that it's focused on problem solving, impact, making a difference. And it's not one model, it's not one methodology. And that's what we've tried. Now, I sat there thinking, my God, I've felt like I've been making this up at times, but he's validating our approach. which is there's a problem, let's fix it. We've got the skills, let's fix it. Yes, use the tools, use the templates, use the whatever to enable, not disable, but do them in a way that's going to make a real difference. And I think if you have got a complex problem to solve and you're thinking about a PMO to help solve it, think really carefully at the outset about making it, I would suggest strongly, think about making it fundamental part of your delivery architecture, not a bolt-on. Think about it being really well led. Give your PMO leader the opportunity to earn respect and credibility and a seat at the top table. Make sure that when you're resourcing it, you think really carefully about the skills that you need to fix the problem you're trying to solve. Don't go just bunch of PMO managers, project managers or program managers. Think about what you need. Is it change management? Is it transformation management? Is it technical skills? Is it specialist experts in certain things? Is it analysts? What is it that you need to deliver what you're looking to deliver? Because I passionately believe, and this is what I've learned on this program, I've never led a PMO before, is a well-led, valued, respected, trusted PMO as part of that program architecture will deliver and can deliver impact and value to your organisation. Thank you. Back to you, Ben.
Thanks very much, Mark. And just to finish, I guess, the vaccination programme has been one of the real successes coming out of the pandemic, and we're really proud that our people continue to support the programme and continue to learn how to deliver at pace in a really complex and uncertain environment. And those skills are going to be really important in recovery. So while the vaccination programme was obviously at enormous scale, a lot of these same principles and a lot of that learning can be applied to programs at any level. So we're working with organisations now nationally, regionally and locally to transfer the learning that we've gained and the experience that we've gained. And we're doing that in different ways through sort of co-designing programs in the ways Mark's described and developing bespoke program toolkits to really embed those fundamentals and robust and efficient and collaborative ways of working from the outset, not as a bolt-on. We're building teams for delivery, but not just the skills, as Mark's referenced, but people with the right mindset. These roles are not for everyone. It's not everybody's cup of tea. And we see quite often they can be assigned these roles to clinical or operational managerial members of the program team as an additional role, and all of that in addition to their day job. And there's a real opportunity cost associated with that. So we're also bringing in teams to entirely run, mobilise or deliver PMOs and programs. But while we've got that focus on operational delivery, we're also really building for the future as well, and developing these skills for the NHS and in different ways. So when people roll off the vaccination programme or other at-scale programmes, we're redeploying them to different challenges, solving different problems in different programmes in other parts of the system. We've got a national campaign underway at the moment to bring in more PMO and programme professionals, people with that aptitude and mindset, and real specialists in some of those niche roles within the PMO environment, but also sort of from the bottom up. So we've got an excellent grad scheme running, and we're training really capable young professionals with these skills, giving them experience in this environment, so as they move through and progress in their careers through SCW and elsewhere in the NHS, they've got really solid foundations to be able to generate this value and make that impact in the future. So just to close, thank you all very much for listening. I think we need to set up now for the next stages of the presentation, but we'd really welcome the chance to have a chat, to discuss, to listen to any questions, queries, or any thoughts you might have about this really knotty problem of trying to deliver at pace, without distraction, without delay, in a really complex and uncertain environment. So we'll be at the back of the stand, and it would be great to chat with any of you. And otherwise, we really hope you enjoy the rest of the expo. Thank you very much.